you?
Hello. Very good. Excited to have you on my couch.
Yes, and it's quite comfortable.
Yes.
That's
And we are doing laser today.
Yes, we are.
Let's discuss laser.
So, we've mentioned laser before, and today we're actually going to show you how it's done. So, it's a light-based device which catches the pigment that's in all of our hair and basically burns it off and keeps it off for a while and eventually permanently.
And you can do it all over, right?
You can do it all over, yes. Safe to do all over.
Okay. So we're going to do a test patch?
So,
Yes.
exactly. We start
Very
with a test
important.
patch. Everyone's skin is different. We never know how people's skin will react, so we always do a small test patch. Usually, if you want to do laser on your hands, we do a test patch on that area. If we wish to do laser on the face, we do a test patch on that area.
Perfect.
So, I think we've agreed to do a small test patch for Dulcima on her jawline.
Okay.
And then we'll have a look and see how she is in about 2 days. Usually takes 24, 48 hours for anything to come up if it's going to happen. So any kind of superficial burns, any kind of blistering, swelling, redness, etc. usually comes up very fast. And if that happens, obviously we'd like to have you call us and then we manage it. But it's very rare.
What happens if that happens?
So, essentially you burn, just like an iron burn or a stove burn, it burns the skin off, so it kills the superficial layer.
But then you have to do a different function on the laser.
So then we have to lower the setting.
it down.
Exactly,
Okay.
exactly.
Okay.
I mean, you can kind of, with experience, you can predict
Of course.
what energy is going to be needed for what kind of skin. But you know, sometimes people maintain a suntan all throughout the year. Sometimes I have people who, you know, come in January and they still have a suntan from September. So you have to be a bit
having
careful.
a suntan is a no-no.
Exactly.
Do I have a suntan?
Issa, we'll see. I'm going to be very careful with your skin because your skin is on the slightly darker side.
Exactly.
I mean, this area generally doesn't get much sun. So yeah, we start from there, and that's why we do these test patch procedures, just to be sure.
Vamos.
Vamos, you ready?
Yep.
So,
Yes.
I generally ask people whether they
I'm excited.
take any kind of medication. Usually it's for acne, so any kind of vitamin A based medication, just because it can make the skin more sensitive to pigmentation post laser. And obviously I don't laser skin which is not intact, so herpes is a very common one because I do a lot of upper lip removals, so any kind of active herpes we skip.
Yes, of course.
Exactly. And people who have more complicated and complex skin conditions, we obviously evaluate that.
Like for example, acne. Do you do laser on acne?
Yes, yes. We clean the face, we make sure everything is clean, and
Because a lot of youths, Yahasra, they're growing up, you know, maybe some of them have acne and
No, for
obviously
sure,
they are
for sure.
getting conscious about the
For sure.
hair. So that's okay.
It actually helps a little bit because acne is actually an inflammation of that entire sebaceous, pilosebaceous unit. So when we remove the hair, it helps to kind of reduce the clogging of that pore so much. Like an ingrown, you know, an ingrown hair is really a clogged pore. So
Can you
once
get ingrown with laser?
You're supposed.
No.
I mean, you can get an ingrown randomly for any reason, but generally 99% of people who do laser, as opposed to waxing or shaving or threading, report absolutely no ingrowns. So it heals them, and it allows the skin to heal any past ingrown or inflamed follicles because you just don't touch it for 6 weeks.
Exactly. Let's do this.
Let's do this. Let me lift you up a bit. So we just clean the skin a bit. We find the patch that we can kind of see a bit of hair there. And then, so the laser shoots out the laser beam, and it also shoots out this cooling agent. So what you feel is a mix of hot and cold at the same time. You ready?
Yes, of course.
All right, here we go. So, how does that feel?
I'm not feeling anything.
Great. And that's precisely what we want to accomplish. not feeling too much, but effectively removing any hairs that might be there. So I do a large enough patch to be able to see any reactions, and then I ask you whether that's
When it's hairless, does it not hurt? When it hurts a bit,
Yes.
that's because there is thick hair.
Yes, the thicker the hair, the more
Okay.
energy would be absorbed. So when you have thin, fine hair, generally it doesn't hurt. Like if you were to laser the palm of your hand, you wouldn't really feel anything. You just feel the cold. So it is proportional to the thickness, the darkness of the hair, and obviously sensitive areas in the body are more sensitive to pain. So,
Okay.
yeah. So how does that feel? It's normal to have it a little bit red. Obviously, we have done something to the skin, and generally that redness goes away after 20-30 minutes, and you forget about having
Even
had-
like people sometimes have fine hairs here, and maybe fine hairs here. We Maltese women, like, you know,
Look,
Mediterranean.
I don't like to touch hair which isn't evidently looking
That's
quite bad, because there is a theory that lasering hair which is thin might actually make it grow worse. The theory is that the laser does heat the skin up a bit, and that heat can stimulate some latent hair growth underneath. So it wouldn't be the first time that I have people who either did an area such as here, or women sometimes it occurs on their shoulders. They actually make it worse. So we kind of less is more, practice less is more. If it's not debilitating, if it's not bothering you to the point where you're actually shaving it, where we say, you're shaving it, you might as well be lasering it then. I generally advise against. So I treat, you know, the classic areas where the hair is thick enough and will function. You know, you'll.
What about hormonal hair?
Yeah. So hormonal hair is one of these. They're quite strong. They're quite dark, and they generally respond quite well
They
to
respond
laser.
good. So
Yes,
that-
and they're in
that's
a very classic place. You never
area.
get hormonal hair
No,
which
of
is
course
growing
not,
on your
yes.
Like
cheeks.
hirsutism.
Exactly. It's generally the
Do you do it on
jawlines.
the eyebrows?
I do the eyebrows as
Exactly.
well. Yes,
Yeah.
you have to be a bit careful with the light and the glasses, but yes, it's safe. It's very
I know
safe.
people who did the laser over here. I know
Yes.
a man, in fact.
Yes.
And then after a while, maybe because it was a little bit powerful, he developed pigmentation.
Yes,
Yeah.
but that happens when you get a burn.
Yes.
So as we
Superficial.
mentioned in one of our
Superficial.
exactly as we mentioned in one of our
Yes,
previous
exactly.
episodes, the skin reacts to inflammation by melanin response. So laser type of burns are a certain kind of damage, injury, and inflammation response, and then you can get the pigment. It happens. Unfortunately, it does happen. It happens to our skin more than lighter skins, but it does happen. So you have to be very careful. You know, that's why we do test patches. That's why we use safe equipment, FDA approved equipment, and that's why we have a very thorough understanding of what the skin is and what melanogenesis really is.
And
Your
that is
turn.
why we have
So how do you feel?
everything-
I feel great.
Absolutely
I feel
nothing.
good.
That's good. That's what
I would.
So that's what laser is. I mean, you feel a little bit of discomfort for the few seconds that we're lasering, and then generally you feel nothing. You walk out of here, and it's like you were never
Wow.
here. So, yeah. And if you're fine, then we can proceed with the entire treatment
Cool.
in a few days.
Your turn. Namlulilek.
Yeah.
Underarms. Where do you want to?
Underarms is a
Laser
good
me.
one. Nobody wants
Laser
underarms. Let's go.
Let's
go.
laser Steffi.
So, as we mentioned, we can do laser anywhere. One of the most popular areas is obviously the underarm. It works very well. The hair generally is much thicker, and this area gets least sun and has very little pigment producing cells.
Okay, so it's safe.
It's one of the safest areas, yes. Again, you have to be careful, but okay, so are you ready? Okay. So you'll feel a little sharp.
What power are you using for that?
Issa, I don't know how to explain to you. It's 10
Alright.
joules at an
Okay,
80
alright.
millimeter.
More powerful than
Than the
It's
Fine.
different. I use different settings for
For
the
this-
face and the body just because of the depth of the follicle in the face and in the body.
What am I going to feel a sharp?
So you will feel like a sharp, like an elastic band is hitting you, and then you'll feel this cool air, which is going to feel good. You ready? Here we go. How does that feel?
Okay.
All right, Steffi.
Yeah.
Still here?
Brave, brave.
No. Well, there's nothing tough.
No. If anyone has ever waxed their underarms, this feels a lot more pleasant, in my opinion.
The smell is...
The smell is interesting.
Burning hair.
Burning.
That's the only reason why the masks are coming in handy these days. Helps. You good?
Yes. Ja, الريحة, eh?
But if you shave,
Yes.
how would you know the area which to cover?
Well, you can never really shave that well, so we can always see a little bit of the hair sticking out. There are times where people have very light hair, and even after they shave it, there's absolutely nothing on the skin, and I can't see anything. So I have them come back in a few days so that it's easier to work.
What should I do after? Should I put
So
some
essentially
cream?
nothing special. I mean, some people feel a little bit of the burn, and I tell them to apply some aloe vera gel or just a cold, cloth or an ice pack. But in a couple of minutes, usually it subsides. I tell people to avoid spray deodorant or any alcohol-containing deodorant for the first 24 hours, just because it can burn. How does that feel?
What's that deodorant to study for you?
ما يسويها لا هاو خليك انت ما يشوفوني.
The longer the hair, the better.
Not really. I mean,
The
Does
darker
it make-
the hair, the better.
the darker the hair and the more dense the hair is set. Otherwise, length doesn't really make a difference. Actually, it's a bit cleaner when the hair is a bit shorter. So,
Okay.
exactly.
What am I going
Shall we leave you half-half? Face off, kind
شيلوا
of
وين
thing.
بس متضايقة تعمل خليك هيك
مور انت الضربة وخليها تمني.
هم هيكون يمور
ما كيدو مرة ماركتينا.
لا مش هيك
We can start a new trend.
ħana jlek x'namlu ħanaqbżu għallu ma nisparixxux minnaw nalqu dir-rokna mbagħad nisparixxu ktar tard x'taħseb
mela.
u mbagħad immorru fil-kċina tilbes
Immorru
il-ġlek
bil-galbu.
l-iskarf x'taħseb
Daqsek.